Hello. 3 billion people live in environments highly vulnerable to climate change. Our recent analysis has shown that the likelihood of a pandemic of the scale of COVID-19 is now 2 to 3% per annum, which means that we can expect such a pandemic not every once in 100 years, but probably every 35 to 50 years. And as was just mentioned, we have a deficit of at least 10 million healthcare workers globally. So that's our baseline. As a recovering trauma surgeon, a humanitarian volunteer, and a pandemic responder, I'm very excited to be chatting with this esteemed panel of Dr. Mehmood, Hevolution, Jeffrey Lee, and Alisha Moopen. So, Alisha, I'm going to start with you, please. Everyone is investing in healthcare innovation, but in fact, for a crisis, we fear that the gap or the break is going to happen at the front line, so the delivery system. What are you seeing with smart money in terms of delivery system innovation?
Thank you. Thanks, Ellen. I think what you mentioned initially was absolutely true, right? The shortfall in workforce in healthcare is a huge problem, and I think the pandemic only made it worse. I think what we saw was a huge exodus of workforce after the pandemic. Like, for example, in the US, they were saying that almost 5 million people left medical field after the trauma of dealing with the pandemic. So we are sitting with a twin problem right now where we are talking about how do we increase the workforce, the supply into the healthcare workforce. And two, the scary statistics that you're saying in terms of the likelihood that we will be dealing with another pandemic in our lifetime is very real, and you're going to deal with it with an aging population. I think I must share one statistics that actually staggering and really scared me was 2018 was a year when the number of population in the world above 65 crossed the number of children under 5. But you fast forward to 2050, and the number of population above 65 becomes double the population of under 5s. And then you fast forward to 2100, and the population above 65 becomes 5 times the population under 5. What does this mean if there's a pandemic, right? You have the aging, elderly, vulnerable population on one side, which is a huge proportion of the population, and who's going to look after this? A shrinking healthcare workforce? So I think we really have to talk about how do you upskill and how do you motivate more people to enter healthcare? So what are the tools and incentives that you need to use to bring back more people to want to join healthcare? And then, of course, when it comes to AI technology, how do you make sure the healthcare workforce can reduce the burden, focusing on the clinical work instead of the admin work? Right now, almost 40% of their time, doctors, nurses, paramedics, is spent on non-clinical work. And that's not fulfilling, that's not productive, that's not the best use of resources, especially in a crisis. So I think these are the ways that we need to kind of really think about the next pandemic and prep readiness for the same.
Thank you. Dr. Khan, as we think about the aging population, one of the silent pandemics that we're experiencing that disproportionately affects that group but affects all of us is antimicrobial resistance. And if we were to accept, at least for now, that there isn't a lot of appetite to invest in new antibiotics or antimicrobials, what could be some of the innovative ways to invest in this space?
I think there's a lesson learned from our recent pandemic, right? Sometimes there's a misunderstanding that the COVID vaccine was developed in 12 months. Why can't we do that with everything else? The reality is the following. The US NIH was investing in RNA technology for 10 years prior to the pandemic. Essentially, it was creating the building blocks for applications of the future. When the pandemic hit, a number of companies took that government-funded technology that had become then applied as IP, so it was public sector funding that created the building blocks that gave us the COVID vaccine. And that allowed, and then it was coupled by government-funded offtake agreements that guaranteed purchase. So let's take a look at this. You think I'm going to give you a science answer, but let's actually take a look at what enabled this. So if we now fast forward, there are 2 or 3 different things that are, one of which I'd like to add on to the comments that's just made. For epidemiological purposes, we look at age based on your birth certificate. What we've now learned, and we can take a number of diseases, age-related cancers, you're a surgeon, we look at the onset of diabetes, cardiovascular disease, dementia. The age of onset of these conditions, on average, is 5 to 10 years younger in this part of the world in South Asia than it is in North America and Western Europe. So age is a biological phenomena. We happen to measure it based on your birth certificate. They're not the same thing. So the actual impact is not the same based on population demographics. Depends on where in the world, the environmental and genetic factors. It's very important in the Gulf region, for example, because we are seeing colon cancer, breast cancer, prostate cancer occurring earlier. These were considered relatively rare in the past. So if we think about immune dysfunction, which is the phenomena underlying the vulnerability of the pandemic, there are 3 things needed. Number 1, a lot more research to be done on how to make existing vaccines and therapeutics more effective. You cannot get a vaccine to work if the underlying immune system doesn't respond. Fundamental biology. And that work has just scratched the surface. Huge markets. That unlock will create a lot of potential because let's take the flu vaccine. 20 to 40% of people who receive the flu vaccine over 65, it works. 2/3 of the time it doesn't work because of that age. So that's number 1. What we call the adjunct therapies. We don't think of those today, but they are the future frontier. Number 2, what are the building blocks for microbial resistance that are going to enable diagnostics, rapid point-of-care diagnostics, but also the right therapeutics that as resistance develops, we can deploy those quickly. And that also is going to take that public-private partnership. Most of this investment historically has not come from the private sector. It's been enabled by the public sector, and we're now in a world where pandemics are global. So the question it really raises is, how do countries collaborate at the same table? Forget political differences. There is no politics in pandemics. Everybody succumbs. So how do you get everybody to the table and say, what are our resources to pool? That's the second phenomenon. And then the third is, can we rapidly deploy scalable supply chains? Because what did we learn? Supply chains were inadequate in parts of the world, and that resulted in challenges. That's where the private sector comes in. Partnering with capital structures. So 3 major buckets of work are going to have to be done in order for this to be taken on. The good news is we've started to take the first steps. That awareness is there, and several governments, including work being done here in the Kingdom. At Hevolution, we are the largest nonprofit in the world that is addressing the challenge of aging, and most Saudis don't realize, but the headquarters is in Riyadh.
Thank you, Jeffrey. I want you to tackle the question of technology and data, and how do we think about its use, given the likelihood of the shift in pandemic profile, but also how do we make sure that we don't develop a 2-tier system and that everyone has equal access to tech advancement?
Sure. Alan, you opened by saying that the climate change and other factors will contribute to the increase of frequency of pandemic. So the first thing I think technology can help is really the predictive capabilities of pandemic. If you can predict more accurately, you can respond more faster and more effectively. And that, I think, is today very important. The earlier we can really identify risks, the better we can really come up with good solutions. And then coming to what Mehmood was saying, this collaboration among governments, I think is critical. Data sharing among all the countries is going to be very important. And digital technology will help people to really see the trends and identify solutions and the ways to solve the problems and to come up with plans of supply chain, supply of manufacturing, etc. So in that sense, I think it's very important. And there are already technologies that are really very, very good and effective in helping, predict the pandemic. For instance, there's an AI-based system called the Blue Dot. And Blue Dot was used, and the data from Blue Dot were able to really define the pandemic 10 days before the WHO gave their first alert. So those technologies are going to be extremely helpful. And then in terms of control of pandemic, now you have the digital health system, like the health code and things, which will allow you to monitor and survey what's happening with the pandemic, the spread of the pandemic, and hopefully you can contain the spread of that as early as you can. And so in that sense, I think technology also is very important in the future to address the issues in the pandemic. So I think technology is one thing that is a powerful tool now we have that is really helping us to face the challenge or meet the challenge of now the increasing frequency of pandemic. So in that sense, I think we really need to in different ways try to leverage the power of technology to really monitor and discover, and then really be able to control the pandemic in the best way.
Thank you.
Ellen, if
Alisha,
I can just add to what Jeffrey said and what you were asking about the 2 tiers, right? I was just remembering last month I was in one of the poorer African countries, and the health minister, he said to me, he's like, there's so much support that comes from the Western countries when it comes to things like malaria and eradication of some of the communicable diseases. And he said, but they're also facing a huge issues, whether it comes to the chronic diseases, diabetes, hypertension, which people are not giving as much support to. And I was like, well, at least you're getting the support on the communicable, and that's important, right? And he said something which was very profound. He said, I'm getting the support because that affects everyone. If there is malaria for me, visitors who are coming to my country, they're worried about their own tourists coming in and getting it, right? So the point I actually wanted to make, Ellen, is I think for us to prevent to reduce the impact of another pandemic, it is very important for us to be thinking much more holistic in terms of how a better health index of everyone in the world is better for everyone. So I can think selfishly, oh, for my country, this is all that I need to take care about, but we're not living in that world anymore. So even if I'm thinking, whether I think as a humanitarian and selflessly that I want good health to be equitable across the world, that's my philosophy, that's my company's philosophy at Aster. But I think for everyone, even if you start thinking selfishly, you want everyone to have a better health, because if someone else is vulnerable and exposed to it, that increases my vulnerability too. So I think as different organizations and countries, as we collaborate, it's very important for me to make sure the person next to me, if they're a different economic segment or a different race, they are also raised, because that's important. That's on one side when you look at the poor thing. I do want to make one point on the other end of the spectrum. I think we're getting to a point where people are able to become like cyborgs. If you have a lot of money, you can almost do your biological manipulation, become superhumans. So you're sitting with a juxtaposition where you've got poor countries on one side, and then you've got people becoming superhumans.
So clearly two-tiered.
Yeah, two-tiered.
Dr. Khan, can you speak to the level of confidence we should have in the current global structures? Is it a paper-based exercise when we look at IMF, World Bank,
Permit me to share my
World Health
thoughts.
Organization? Actually,
80% of countries lack adequate healthcare AI governance. China's digitized health market, projected to reach $112 billion, shows rapid innovation is possible. Is technology truly democratizing healthcare and tackling its infrastructure challenges, or does it risk exacerbating algorithmic bias and inequity?
Thank you to the avatar. So Jeffrey, I will come and ask you that question in one moment, but Dr. Khan first, you said that we need governments to collaborate. How can we get radical in terms of getting prepared?
Well, look, I don't think it would be aspirational, but I don't think we can solve the fact that governments are accountable to their own citizens. And to ask governments to take revenues from their own citizens and deploy them as government policy for the benefit of other citizens hasn't happened, unless there's local benefit too. That is the reality of the world, and I think suggesting it isn't going to get us the answer. I'm a practical person. So let's look at what is possible. Pandemics, a relatively easy answer because it's going to transfer. Yeah. Some areas, dengue has now arrived in southern United States. Yeah. Malaria, endemic dengue. Yeah. Once that happens, I think we're going to see a rapid deployment of investment in some of those diseases. Chronic diseases, I agree with you, there's plenty of investment. Those collaborations, but the real is going to be at some point, to the point that Jeffrey made, can we pool the right amount of data? Because if we're going to understand the spread of disease across regions, we have to not only understand the pathogen, we have to understand the host.
Yes.
The person getting infected, or the person whose disease, diabetes is not the same in somebody living in New York versus living in Asia. I can tell you, being of Asian descent, an Asian growing up in England has not got the same disease as an Asian growing up in Asia. So we are going to have to look at this data and pool it. It's not going to be sufficient to say, I did a trial in New York or London, and therefore let me tell you the data, and now we're going to deploy it, which is, these are things I think will incentivize collaboration because there's a win-win. Doing it one way or the other is not going to help us.
So getting a segment of one, to your point, for the individual and the context. Jeffrey, back to you from the avatar's question around, first of all, can you tell us, bring to life how digitized China actually is right now from your perspective in its healthcare system? How well digitalized is China right now?
Yeah, first of all, China has now become one of the pioneers in AI and ChatGPT and data analysis, as represented by Kai-Fu in the last panel. Secondly, I think China has really used the technology very, very effectively to address a number of social challenges. In the payment system, we know China is the first to really use technology very widely to really replace cash and credit cards and things. In healthcare, China has this healthcare system which was developed during the pandemic, which is very effective to identify where the infection is happening, and very quickly be able to contain that infection within a very small area. And that is something was proved to be extremely successful during the pandemic. And for a period of time, for most of the 3 years, that the infection rate of Chinese COVID is extremely low. We're talking about for 1.4 billion people country, most of the time you have 1,000, a few hundred infections. So that is very much due to the effective use of the technology. And now I think telemedicine is another thing. China is using also AI for a lot of the disease analysis. For oncology, they are now using AI to help physicians to diagnose cancer, etc. It's fast developing. So we're seeing the merging of healthcare and technology happening rapidly.
So we've talked about government collaboration across countries, but making sure that we look at the citizens as well as the global citizens that are impacted, that the public and private sector needs to come together, that we need to think about the baseline health infrastructure, both of the individual in their context, but also the health system that's supporting it, and bolster that as we think forward. And we need to gear up for significant investment in this space because we're expecting a much rapid cycle. 2 words, Dr. Khan, what else do you think we should keep an eye on?
Look at the return on investments in our current healthcare systems. If you plot a graph, you may have seen this, of impact on life expectancy and health, quality of life of a population against investment, public health.
Yeah.
It's not an 80-20, it's a 20-80. 20%, if you plot all the countries that you have data, 20% of the investment gives you almost 90% of the return. The remaining 80% of what governments are spending gives you another 10%. While at the same time, in a country like the United States, 40 million Americans have no health insurance. So the question we have to ask ourselves across country by country by country, that if you keep investing more, and ministers of finance ask this question, if I keep giving more money and my population impact doesn't change, at some point, if we were a business, we'd be asking ourselves, what's the ROI? And the ROI is terrible after the first 20 or 30% of investment at a population level. That's where technology comes in. We have to get at that and say, how do I get far more for the dollar I'm investing, or the real, than just putting more at it? And that's where I think innovation and some of the things we're learning from China, Asia, the global south, are really going to change the game.
Thank you. Alisha, for you?
Ellen,
In 1
say
minute.
2 words, I would say it's primary care and digital health.
Love it.
If you're able to make the foundation strong and create a really good primary care system, you can avoid a lot of the health burden that is caused on the system, which ends up being very expensive, to Dr. Khan's point, because it becomes unsustainable then. So solid primary care is my goal.
And Jeffrey?
Yeah, local manufacturing, I think, is critical. And the other thing is resilient supply chain. Those 2 are going to be very important when we have the next pandemic.
I'm optimistic, actually, given that what you've said, there's a lot of waste in the current system and a lot of opportunity through AI and digitization, and a desire probably for more collaboration than we've seen before, given our recent experience. So thank you very much to my esteemed panel. Thank you very much.
Thank you.
Thank you.